Welcome to my channel, ladies and gentlemen. It's Dr. Emmanuel. I'm a general practitioner in the United Kingdom, and I make YouTube videos to share my experiences and my thoughts. In this video, I want to talk about artificial intelligence. In recent past, there's been a lot of talks about whether artificial intelligence will replace doctors, in the medical profession. My personal take is that artificial intelligence will be very difficult to replace doctors. I know there are they're just these gigantic dogs. So I just saw those gigantic, dogs, and they're mastiffs, mastiffs. And as soon as I saw them, it just felt like lions walking into my visual field. They're so massive, So let's get back to the video. Will artificial intelligence actually replace doctors? I don't think so. Obviously, there are certain things that maybe doctors, used to do many years ago that, technology has greatly improved. Obviously, we have a lot of machines, ECG machine, blood monitoring machines to check your pulse, your oxygen levels, your pulse. There are so many machines, automated ECG machines that actually interpret a lot of things now. We have ECG machines that interpret ECGs, and machines that interpret a lot of things. Okay, that is very helpful, to be honest. Even though we still, obviously, as doctors, we still look at things to double check to make sure the machine has not wrongly reported on something, or to make sure the machine has not, failed to report on something. So we do all of that. But ask yourself this question. If you're feeling unwell now, and you go on, maybe there's an app, an AI medical app, and you put all your symptoms in. Let's say, okay, you can't tell the AI, in the last week I've been having headaches, feeling very tired, blurring of vision, feeling agitated. I feel my heart is racing and thumping, and you put all your symptoms, and AI tells you, I think you have hyperthyroidism, overactive thyroid gland. Now, I wonder what the AI might say. The AI might tell you, okay, if that is the case, maybe you should run some lab tests to confirm. So maybe AI will tell you, run some lab tests to confirm. Or maybe AI will jump straight into telling you to take medications for hyperthyroidism. So if the AI tells you to go to the pharmacy and get a prescription of maybe carbimazole or propylthiouracil, which are medications that are commonly used in treating hyperthyroidism, do you think you would accept to walk into a chemist, buy that medication and start taking it? Personally, I wouldn't. Even if AI tells me that, let's assume I was not a doctor, I didn't know about this. If AI tells me to go into the chemist, buy a medication and take it, I'll still call a doctor on the phone and say, Doc, I put my symptoms on this AI app and AI told me to buy carbimazole or any other medication. What do you think? So I will still want that human factor, that human input in making that decision, because it concerns my health. If I take the wrong medication or the wrong treatment for my symptoms, then that might actually be life-threatening, or it might lead to complications that I might have to live with, and I don't want that to happen. So I think in that regard, AI will very unlikely replace doctors, because it's all about trust. When you walk into your doctor's office, it's all about trust, first of all. It's all about trust that what this doctor has told you to do or to take, and you believe them. You believe they are qualified medical practitioners, and you trust what they're telling you. If a patient doesn't trust what their doctor is saying, very likely that patient will seek a second opinion, or they will go online and they'll go and read about, they'll to read thoroughly about what everything you've told them, all the advice you've given them, to see whether what you're saying is actually true or not. And if they find out that you've said something inappropriate, then obviously they'll take it up. They'll speak with your practice, where you're working. They'll file a complaint if they think you've told them something that is wrong, something which, if they had followed through with that advice, may have caused them some damages to their health. So usually they will want to report that as a safety concern. So I don't think AI, artificial intelligence, will completely phase away the kind of medicine we practice today. I seriously don't see that coming. Let me paint another scenario. Imagine if a machine is supposed to carry out a surgery on your eye, on your brain, on your spine. We have robotic surgery. When you hear of robotic surgery today, it does not mean that a robot is 100% responsible. It does not mean that a robot is 100% responsible for carrying out that operation on your body. What it means is that a surgeon is using a robot to conduct that operation. So the surgeon is the one controlling the robots. That's why it's called robotic surgery. But imagine if a robot that has an AI coding is going to solely, 100% be taking decisions on where to cut, what to remove, what to suture. Will you, as a person, lie down, subject yourself to an AI robot giving you anesthesia? An AI robotic surgeon, not a human being, without a human input, carrying out a surgery on your brain, on your spine, on your eye. Personally, if I find myself as a patient in such a situation, I wouldn't agree for a robot, for an unmanned robot, to carry out a surgery on me. I wouldn't agree to that. Because I believe and I understand that every machine can malfunction at some point in time. A robot that is supposed to remove and replace it, remove a cataract, a disease lens, and put an artificial lens, might end up removing my entire eyeball. Because maybe at that point in time, it experienced a glitch in the coding. Okay? Or maybe something in the hardware, something got stuck. A mobile part of the robot got stuck and it just malfunctioned and injured my brain or spine. So I wouldn't 100% put my trust in artificial intelligence when it comes to my health, bearing in mind that any mistake can lead to life-threatening complications. And that also leads me to this point. A lot of the time, when things go wrong, we want to have someone to blame. So if a patient takes a medication and they have maybe anaphylaxis, life-threatening reactions, or they go home and read that particular medication the doctor has prescribed for them might actually cause them harm if they take it because of the other medications that they are taking, what we call drug interactions. They want to be able to say, yes, this is the person who prescribed the wrong medication for me, or this is the surgeon who carried out the operation, that led to this complication. They want to be able to point fingers at someone. If a machine, an AI machine or an AI app prescribes wrongly to you, who do you blame? Who do you sue? Do you sue the AI company? Because most times those companies will usually put a disclaimer. They will always put a disclaimer, and that disclaimer will legally protect them if something goes wrong. There'll always be a disclaimer to protect themselves. Who do you blame if things go wrong? This is the reason why I think it's going to be highly impossible or almost impossible for artificial intelligence to completely phase out the job of doctors, nurses, and many other healthcare professionals. Leave your comments, your thoughts in the comment section. Let me know what you think. Again, if you've not subscribed to this channel, kindly hit the subscribe button, like this video, because what it tells the YouTube code, which we popularly call the algorithm, is that this video is useful that you found this video helpful and they're going to recommend this video on the screens of other YouTube users. Even if you don't think it's the best made YouTube in terms of quality and content, at least for trying, for the fact that I put in a little effort into this, I would say kindly like the video. And as you do so, I wish you a happy day. Take care. Bye. See you next time.